Hello, my name is Andy Jackson, and I've been in the nursing home industry as far back as I can remember. You see, people get into the industry in different ways. I just happened to be born into it. My family and their business partners opened a facility in 1973. I was 3 years old at the time, and as I got older, I can remember what the nursing homes really were and what they really did. And over the years, I've seen the industry change, and it hasn't changed for the better. It has actually gotten horribly worse, the worst that I can imagine. I can't even imagine it this bad. And I've been doing this for 48 years, ever since I was a kid. And it used to be all about the patients. And there was a time when it was. And the owners worked together with the other facilities. The state worked with the facilities for the betterment of the residents. Now, somewhere along the way, it's changed. You know, big corporations have moved in. They worry about nothing but the profits. For the last 30 years, the government that's overseeing the nursing home industry are complacent. And they're not putting the money where it should go. And they're allowing the residents to be neglected and abused in these facilities. You know, and I don't understand that. You know, the only reason I can figure why they're doing that is that the big corporations, they want money. That's all they're interested in. You know, they ain't worried about your loved one in the facility. They want the profit numbers. And the government, they want full control. So these two go hand in hand, and the public's left with nothing. And I'm telling you right now, in the nursing home industry, it is absolutely horrible. I mean, people are being neglected and abused across the board from these huge corporations. And the state of Maryland, they're not doing anything about correcting it. You know, right now they're doing their surveys out there on facilities, picking them apart. And these surveyors, most have never worked in a nursing home. Most have never even seen how a nursing home really works. And so the people coming into the industry today, they think this is how it is. And it was nothing like that. It is very easy to take care of another person. How many people across this country do it every single day? Take their loved one to a doctor, bring them home, do what the doctor says with no problems whatsoever. You know, so when did this industry change to where government officials are the ones writing the laws and rules for the nursing homes? You know, it should be the professionals that are writing the laws and the rules with the government oversight of that. It's backward. You know, we should be telling the government what to do with this. We're the ones that work in it every single day. They're not. So they're the ones that need to be going to the training and the seminars. You know, the people that's been doing this for 30, 40 years, they're at the top of their game. They know how to do this stuff. You know, that's why they go to school. That's why they're professionals. That's why they're licensed. But yet the government comes in and micromanages them to death to where we can't even function anymore. So I decided to leave the industry. You know, once after COVID, I decided to get out of the industry because they were not going to fix it. And they had a perfect opportunity to come in and fix this industry. But they didn't. They've covered it all back up and moved on to where the government gets all the control, and these big corporations are coming through and buying up facilities like crazy. Now, why would they be buying these facilities when they can't even keep them staffed? Right now, a lot of these facilities at nighttime are running 1 aide to 30 residents. The state of Maryland knows this. They don't go in there at nighttime and catch them doing this and close them down. They allow it to happen. And I don't understand why that is. All the ombudsman people, where are they at? They're supposed to be there protecting the residents. You know, I'm telling you the truth. So as healthcare workers, when the government has full control, and as an owner of a facility, my family were, that we have no control over the nursing home. People keep saying sue the nursing homes have to straighten up. The government has full control. They tell me everything to do. And then they bring in these surveyors that they pay them that don't understand the industry to grade us. It makes absolutely no sense. It's like a dog chasing its tail. So I left the industry, and I opened up a free website to the public to give them all the information that I can on a nursing home. You know, on where you should go, what you should look for, and a solution to the problem. You know, because like I said, me and my colleagues, we can remember when this industry worked. We were there. Yeah, it had its problems in its day, and even at my facility, I had my own problems with it. From having abuse in the facilities, you know, we had the same bad things happen to us. But what made us different is we put everything into it to avoid that from happening again. The corporations, they won't do that. They'll just pay their fines, go on, and try to get that profit number up as high as they can. So this website, you can go to Professionals Verifying Nursing Home, the number 2.com. That's just PVNH, the number 2.com. And it's a free website for the public, the residents, families, on what's really happening in this industry. And the easiest place to start looking for the problems is the cost reports. Now in Maryland, you can go right to CMS and get a copy of the cost reports on the nursing homes. You know, you can pull mine. Mine's out there too. They're all out there. It's public information. This stuff is not hidden. Well, they hide it so you don't find it. But like I said, dig into these cost reports because that shows the financials of every facility out there. Shows you where the money goes, you know, and you can use that to see just how crooked this industry has become. They've built this industry up onto $1 billion and it's sitting on the neglect and abuse of the residents. And probably one of the greatest generations of our time. Whatever generation has ever seen this much change? And then to be thrown into a facility like they are and treated the way they are, I've seen it with my own eyes. So how are we as healthcare workers supposed to come back into the industry when it's this corrupted? So I'm asking you as the public to help us fix this industry. And I'm going to give you all the information. You can look it up yourself and see if this isn't the most crooked money scheme on the elderly in human history. You know, people can talk about how America got here, all the horrible things they did. All countries did horrible things in the past. But with all this technology and everything that we know today, what is this government's excuse for allowing this to happen? And especially to the elderly and the less fortunate. They're being pushed aside so they can bring in all the rich people and drain every dime of them that they can and then go look for another one. And that's what they're doing. You know, how many people out there know that in Maryland they've sold over 17 facilities? Over 17. You know, and then I heard that just in West Virginia, another big corporation bought up a bunch of facilities. You know, and see, these large corporations that, like I said, they're profit motivated. And for some reason, the government is supporting them, I guess, to keep themselves in control and power, and yet your loved one is being neglected and abused. Because like for an example, how many people out there can remember or even heard about a resident that was bedridden and laid in a bed for 2 days with a broken femur? Nobody did anything until finally they sent her to the hospital and the hospital reported them. You know, and I'm sure they got an investigation, they got a 35% discount on their fine, and they're still running today. You know, or how about a facility that took and had a resident that was raped and murdered in a nursing home? How many people heard about that? That was just a few months ago. And it's the same company in 2 different states. And these large corporations are all over the country and nobody's monitoring them and putting them together, and they're able to keep all this stuff hidden. You know, and that same company in the quarter made over $100 million. That's right, $100 million. But in their facilities, they had a lady with a broken femur and they had a lady who was raped and murdered, but yet they make $100 million. You know, and these government agencies, they know this. They don't, when do you ever hear of a facility being closed down? The only ones you ever hear of being closed down is if you steal from the Medicare, the federal government. They'll close your facility for that. I know of a facility that happened to. But other than that, no. You can pretty much do what you want, pay the fines, and they keep motoring on. And I love my industry, and I'm not going to allow that to happen. Because these facilities, they're buying these companies up as quickly as they can because they know full well once they have enough of them, they're going to start pressuring the states. They need more money in order to take care of these people. It's already been whispered about $10 billion to fix this industry. Now, I don't know about the country, but I can tell you in the state of Maryland, working there over 30 years as an accountant and administrator, that state's overpaid, way overpaid. But the money is not going where it should. It's going to these high executive positions, it's going to corporate profits, and over to the government side. Not the surveyors, you know, they're doing their job for what they're given. They've been cut to pieces also. I'm talking about the higher ups. They're not making this money go where it used to. Because when I was younger, in the day when nursing homes did their job, the money went where it was supposed to. And it was limited. You know, if you did a good job, you did everything right, you would take and get your reimbursement plus 10%. It was a great system. It took the profit motive out of the system, and it left people in there that want to do the job. Because like my family, I'll open up my cost reports. I got 48 years of them. I can show you every penny on where it went to. And I'll show you a group of people that weren't greedy and didn't want to take advantage of people. And they did everything they could not to. And yes, we still had bad things happen in our facility, and I can show you every one of those where it was from the government not allowing me to have the people in the facility that I need. You can't run, right now they've got it down to one nurse for 99 residents, one nurse for 99, and one aide to 15 residents. Now that's resident abuse right there. Where's all these attorneys that holler resident abuse? Where are they at? I've called them all, nothing. I've called all the news agencies. Where are they at on this story? I would have thought they would have dove into this, neglect, abuse, rape, and murder of a billion-dollar industry. I thought that would have been newsworthy. But it seems as though our news is crooked. They went down the same ugly road. You've got Democrat news and Republican news. But the American people, we get no news. So the entire system's backward. You have the government telling health care workers on how to take care of people. They don't know how to do that. So I'm saying bring back the professionals to take and redo this industry. This is 2022. This shouldn't even be happening. This shouldn't even be a question. But as you dig into these cost reports, remember to go to CMS, get 5 years of them. And they're thick. Just on mine alone is 4 inches thick for 1 year. So all the numbers are there. And like I said, pull 5 years of the facility that your loved one's in. Don't look at the companies, these big corporations as a whole. Break them up individually and look and see what it is they're doing and where they're putting this money to. And I do believe the public, once they see that, will see the government that's out of control in this industry, that's allowing these corporations to do what they're doing so they can end up and get more money. And like I said, whispered 10 billion, don't do that. Let's do an audit first, and I'll show you that it's overpaid. Because now they want people in there that have a master's degree in mental health and stuff like that. You don't even see the patients anymore. You're locked up in an office somewhere doing paperwork for corporations or for the government. What makes a good administrator out there, I can tell you, would be to have a 2-year LPN license. That should be a license, not a certificate, and a 2-year accounting degree. That puts the two together. Myself, I wished I'd have had the nursing degree, but in the family business, my whole family's nurses. I was the only one that went out to be an accountant. And then I got my administrator's license. So like I said, I'm going to put out the website for you to look at. And if you have any questions, if you need help reading the cost reports or something like that, email me. I'll do whatever I can to help you with this information. But the industry has to be turned around. And I'm asking all you healthcare workers out there, you went through a horrible event and you know this is wrong, but you have nowhere to go. So that's why I put this out to the public to ask them. As healthcare workers, the government is doing it wrong. So who do we go to expose that and to fix it? So as far as I know, the public's still in control. So that's why I'm coming to the public and asking you to help us fix this. Dig into this industry and we'll show you where it's wrong and how to fix it. On my website, I give a solution on how it used to work. And that system worked great. And so I want to get the industry back to that. And so you healthcare workers, send me your stories. Let people know out there of what is really happening in there. How many of you professionals have been out there made to lie in order to protect your job from these big corporations? So yeah, don't let them get away with it. Help us turn this industry. We can do that. It's not difficult. And for everybody there says that you can't do anything, sure you can. Help us change this industry. Because it's one of the best industries there is. What is better on this planet than to help another human being? So I'm asking you as just a human being on this planet, not as a Democrat, not as a Republican, not as an independent. Throw all that stuff away. We're talking about helping other people that desperately need it. So help us come together on this one issue, and let's come together and fix that. And then we can move on from there. But this generation, it deserves much better than this. Even our hospitals, they're in turmoil. They're just as bad as we are. From the corporate greed and government control, it's got to stop. Because I believe in the last 30 years I've been in this industry, when history looks back at this government over the last 30 years, it'll be one of the most crooked governments in human history because they have no excuse. They can't plead ignorance as their predecessors did in the beginning. They didn't have any guidelines or any information. They did what they could. So what in the world is this government's excuse for today? And see, they keep you so busy in the industry, I didn't see it. I didn't see it at all until I got out of it. It took me 6 months once I got out of the thing to look back and really see what this industry has become. And it's nothing like it used to be. And for my colleagues out there, the ones that are still holding on to their companies, and they're doing the best they can, but the government is pounding on them. And it's going to get to where they're going to just get tired of it too. And they're going to walk away. And now then you're left with nothing but giant corporations, just like in the hospitals. They're eating up the monies and not paying the people like they should do it. So we're going to fix this industry. I'm going to put everything out there. It said it's all public. It used to be out there. And so we're going to pull it all out into the daylight for the whole world to see it. Because we need to correct this industry. I don't want to be a part of this industry that does this to people. And I've seen the look on their faces. How many people right now are scared to death that they have to go into a nursing home after the holidays? When you look back at all this stuff, I was trying to think of another story I could tell you to make this sink in. Why is it that the government, I had a resident at our facility that seen werewolves and vampires. He was capable, he's walking around and everything like that, but he did have psychological problems. Now, our staff worked with him, had him there, and had him to where he'd done pretty good. And the state comes in and decides that he doesn't no longer need nursing home care. They want me to put him out to a group home or somewhere else. Now, my staff are very, very good. This is what they do. And they knew darn well they cannot let that man outside. Because just a simple question. If he got outside on a full moon and got a pistol down there in Baltimore, what do you think would have happened? You'd hear another shooting. That's what you would hear. And all these people hollering gun control, gun control. Why don't they look at the psychological issues and go back and look and see when these psychiatric facilities were started to be closed down in the later 90s and see if that and when shootings started popping up, because people cannot go out and get the help that they used to. There's not many of these psychiatric facilities left. In Maryland, I was the last. There's nobody that takes the psychiatric residents like we did. You can ask anybody in the state of Maryland. That's what we did. We took care of the psychiatric residents. And now nobody does, because the state of Maryland doesn't pay anything for them, $250 a day maybe, when these big corporations have built these $30 million projects and stuff, so they need the $600 a day. So then the people that really need the care and stuff are pushed out to the streets, group homes, and are just forgotten about. The rich can go anywhere. They've got money, they can do anything. They can bring in the nurses or whatever, that's fine. But you're not going to take advantage of the less fortunate and the elderly to keep your profits going. So like I said, we're going to take and put it all out there, help you go through these companies and dig in and really, really research them. And like I said, the cost report's just key. That's going to show you where the money goes. As they always say, show me the money. Well, let's follow the money. And we do that and we'll fix this industry. Because if the public could see what I've seen and seen how this industry used to be and see what it's become, they'd fix it tomorrow. I don't believe the public wants this. It's just the public's not aware. Because their news media refuses to dive into this story. For over a year, I've been sending it to governors, senators, all the news media sites, everyone. And not one person wants to do it. So I'm going to do it. And I'm going to give you every bit of the information. Anything you want to know, email me. I'll answer any question you want to know. Because it's all public. And I mean to make it that way again. Because I want to fix this industry and put it back like it should be. So that if someone has to go into a nursing home, they're not dreading that thinking they're going to die. They're going to be thinking, well, they're going to take care of me. And it shouldn't be, I got to find a good one. It should be the closest one to you. That's what they're there for, to keep you there in your community. So I'm asking again for the healthcare workers, come forward with me. Help us put this information out there, because we can do better than this. You know it. But the government has to be put back in its place. It's become too big. And in today's world, government should be getting smaller. They should be asking us a lot more on what we want. Why is it getting bigger? So, that may be fine in other industries, but not in the healthcare. Not in the nursing homes and hospitals, because like I said, they've been destroyed. And they're not getting any better. And so let's fix it. Again, let's all come together for this one issue, set everything aside, forget the news medias, forget about another crooked official out there or a laptop, and let's focus on the residents getting the care that they deserve. So again, you can go to Professionals Verifying Nursing Homes, the number 2.com, and that will give you all the information, and I'm going to keep uploading it. And if there's more information that you need, let me know, and I'll put it up there. So, and we can do this. It's not that hard to take care of people. You know, it shouldn't be like this. So I'm saying, let's pull together and do that. You know, so I'm hoping that we haven't become the country that has just become so greedy to step on everybody just to make the dollar. You know, that's no way to be at all. So like I said, let's put all this foolishness aside, come together on this issue and fix this industry. So, and again, go to my website, and like I said, any information you need, email me and I'll put it out there. So thank you very much.